The fluorescent lights hummed their 2 a.m. song, a sound Brooke Sullivan had learned to tune out 3 years ago, the same way she'd learned to tune out everything else. Sacred Heart Hospital sprawled across downtown Houston like a sleeping patient, and she moved through its corridors the way she'd learned to move through forward operating bases, present but invisible, competent but unremarkable, the kind of person you'd forget the moment she left your line of sight. That was the entire point. That was the order, delivered by handlers whose names she'd never learned, spoken in a conference room she'd never been back to since Tikrit went dark and the files that proved she'd ever existed were burned. The night shift suited her. Fewer people meant fewer questions. Fewer faces to remember, fewer conversations that required her to construct a civilian identity she'd never quite believed in. She'd been a nurse for 6 years now, 3 of them here at Sacred Heart, and the muscle memory of it had settled into her bones the way it settled into real nurses, except her hands knew other things too. Things about tourniquets and field triage. Things about pressure points on the human body that had nothing to do with foreplacement. Things she was supposed to have forgotten. The ICU ward stretched before her, a row of rooms separated by glass and monitored by machines that never slept. Room for 12 had a post-op cardiac patient, a 67-year-old man named Henderson recovering from a triple bypass. Room for 14 held an elderly woman with sepsis, fighting the infection 1 hour at a time. Room for 16 was occupied by a teenager with a crushing injury to his left leg, waiting for surgical follow-up in the morning. Routine cases. Quiet cases. The kind of night where the worst thing that happened was a beeping for pump and a patient who couldn't sleep. Brooke moved between them with a practiced rhythm. She checked vitals on Henderson first, her eye scanning the monitor, BP 118/76, heart rate steady at 68, oxygen saturation at 97% on 2 liters. Good numbers. She made a note in his chart, her handwriting small and precise, the kind of penmanship that drew no attention. The full line in his right arm was still patent, the fluids running clear, no signs of infiltration. She'd placed it herself during his initial intake, and her hands had moved with a certainty that surprised even her, the needle sliding into the vein with the kind of muscle memory that came from having done it 1,000 times before in conditions far worse than this climate-controlled room. In dusty tents. In the dark. Under fire. She didn't let herself think about that. Room for 14 came next. The elderly woman, Mrs. Chen, according to her chart, was sleeping restlessly, her body fighting something it couldn't see. Brooke checked her temperature, her blood pressure, her oxygen saturation. All stable. The antibiotics were flowing, the dialysis was scheduled for morning. Brooke adjusted the blanket across Mrs. Chen's thin shoulders, movements gentle and economical, nothing wasted. Mrs. Chen stirred but didn't wake. The teenager in 416 was awake, staring at the ceiling with the particular boredom of someone who'd been hospitalized too long and was running out of things to worry about. His name was Marcus, and his leg was wrapped in a compression dressing that would come off tomorrow for imaging. Brooke changed the 4 bag in his line, her movement smooth and routine, and when he tried to make conversation, "You work nights a lot." She offered a thin smile and said, "Quieter this way," which was both true and not true in ways she couldn't explain. By 2:33 a.m., the ward had fallen into that particular rhythm that only happened in hospitals after midnight. The machines beeped their steady songs. The ventilators wheezed their mechanical rhythms. The occasional nurse or aide passed through, but most of them gave Brooke a wide berth. She had that effect on people, not unfriendly, just distant. The kind of coworker you didn't ask personal questions because you understood intuitively that there was a boundary there, invisible but absolute, like a fence made of something you couldn't quite see but definitely couldn't cross. That was intentional. That was survival. At 3:15 a.m., Brooke needed to access Dr. Ashford's office to grab a patient chart that had been misfiled. She'd done this 100 times before. The administrative wing was mostly dark at this hour, just the emergency lighting casting everything in a sickly greenish glow, and the hallway was empty. The chart she needed was technically on his desk, according to the night supervisor, so she approached the office door without hesitation, moved with the unself-conscious confidence of someone who had every right to be there. The door was unlocked. She pushed it open, What she saw made her pause. Dr. Ashford's desk was covered with patient files, not just one or two, but stacks of them, spread out in a pattern that suggested systematic review. But it wasn't the files themselves that caught her attention. It was the log beside them. A handwritten ledger. She recognized the format immediately because she'd seen similar documentation in military field hospitals, though the content was different. Where there should have been morphine administered to patients recorded in the electronic system, this handwritten log showed something else entirely. Numbers that didn't match. Doses that exceeded what the pharmacy had dispensed. Dates and times recorded in a careful hand that wasn't standard medical abbreviation. Medication diversion. She knew what she was looking at. She'd seen it before in field hospitals where supplies were scarce and some people decided to supplement their own personal pharmacies. This was different. This was systematic. This was someone who'd been doing it for a long time and had gotten comfortable enough to keep physical records. She stood in the doorway for exactly 1 second too long. She didn't move forward. She didn't lean in for a closer look. She didn't touch anything. She was trained for better than that. But her eyes lingered on the morphine log, and in that single second, her brain catalogued details, the dates going back at least 8 months, the signature on the bottom of each page, the exact pattern of the discrepancies. The training kicked in before conscious thought could catch it. Observe. Record. Don't engage. The problem was that awareness worked both ways. Dr. Ashford's office had a second entrance, a narrow passage that connected to the physician's lounge. She didn't hear him emerge so much as feel the air pressure change, the way it changed when someone stepped into a room with purpose. She turned, her expression already shifting to something neutral and apologetic. "Sorry, Dr. Ashford, I was just grabbing the Henderson chart. I think it's on your desk," but before she could speak, he was there, filling the doorway with a kind of presence that made the oxygen in the room seem scarcer. He was in his early 50s, the kind of man who'd learned that authority was a commodity you could purchase with the right suit and the right confidence. Tailored charcoal jacket, silk tie the color of dried blood, a Rolex that caught the emergency lighting like a promise. His face was lined in ways that suggested he'd seen enough of life to be cynical about it, and his eyes were the color of a stormy Atlantic, the kind that didn't hold warmth. She'd worked under his supervision for 3 years without ever truly seeing him until this moment, and the intensity of his gaze made her understand immediately that she'd made a mistake. He saw her. Not as a nurse. Not as a quiet night shift employee who kept her head down and never caused trouble. He looked at her the way a predator looks at something that might be a threat, and in that moment, Brooke understood that her 3 years of invisibility had just ended. His eyes moved from her face to the desk behind her, cataloguing what she'd seen, calculating the damage. She could watch the math happen in real time across his expression, the moment he decided she was a problem that needed solving. When his gaze returned to her face, there was something different in it. Something cold. Something that reminded her of combat situations, when you realized you'd made a miscalculation and the person across from you had already decided how this was going to end. "The chart you're looking for," he said, his voice like a tank idling in a garage, low and heavy and full of lethal potential, "is in the nursing station. Not on my desk." It wasn't a request. It was a correction. A boundary being drawn. A warning. Brooke nodded once, a gesture so small it was barely a movement at all. She didn't apologize. She didn't explain. She simply turned and walked back toward the nursing station, her posture perfect, her breathing controlled, her hands steady as surgical lasers. She could feel his eyes on her back the entire way down the hallway, and she knew with the kind of certainty that came from 20 years of reading dangerous people that everything had just changed. What happened next wasn't going to be obvious. It wasn't going to be loud. But it was going to be systematic, and it was going to be calculated, and it was going to be designed to neutralize the threat she'd just accidentally become. The overhead page crackled through every speaker on the surgical floor 2 hours later, Nurse Nightingale to the supervisor's office. The nickname dripped with mockery so calculated, so deliberately amplified, that every nurse within earshot heard the summons. Brooke kept her hand steady as she finished checking the 4 line on room for 12. 3 colleagues at the nurses' station exchanged glances. Nobody made eye contact with her. She walked past them like she was moving through water, her scrubs whispering softly against her legs, the fluorescent lights casting everything in that sickly pale glow that made honesty impossible to hide. The supervisor's office was empty. Ashford found her on the way back, blocked her path in a supply closet during her inventory count. His body filled the doorway like a dam. She was counting morphine vials. The irony wasn't lost on her when the door closed and his shadow fell across her hands. "You have very curious eyes, Nurse Sullivan." His voice was low and venomous, the kind of whisper that carries more threat than a shout. "I saw you hesitate in my doorway. So you look at the files on my desk." He stepped closer. The space between them became impossibly small. One more question about medication discrepancies. One more glance at records that don't concern you. And I'll make sure this job disappears. Along with every reference you'll need for the next one. Brooke set the vial down. The glass made a soft clicking sound against the steel shelf. She did not look at him. She did not tremble. She took one measured breath, deliberate, controlled, the kind of breath she'd taken before inserting central lines in dust storms, and felt a single tear escape her right eye. She wiped it away without breaking eye contact. When she spoke, her voice was steady as a surgical laser. "I've survived worse men than you, Doctor." She walked to her car with her spine straight. The dawn light was coming up over Houston like a slow burn, turning the parking lot concrete the color of dried blood. 6-day shift nurses were arriving, filing through the employee entrance in groups of 2 and 3, their faces still soft with sleep. Ashford caught up to her near the staff parking area and announced it loud enough for all of them to hear. "Miss Sullivan is being moved from ICU to post-surgical recovery effective immediately. Due to performance concerns." He said it like he was reading a grocery list. Some people simply aren't cut out for critical care. Nurse Chen, who'd brought Brooke coffee 2 days ago, who'd asked about her weekend, turned to another nurse and whispered something. The whisper was audible. Everything about this moment was designed to be audible. Brooke stood in the dawnlight while her professional reputation crumbled like old concrete. She did not cry. She did not argue. She did not ask why. She simply nodded once, turned, and walked to her car. Her hands did not shake when she gripped the steering wheel. Her breathing did not accelerate. The trembling wasn't fear. It was restraint. Pure, uncut, military-grade restraint. She worked her first post-surgical recovery shift that afternoon. The unit smelled like antiseptic and stale coffee, a combination that made her think of forward operating bases and the silence of rooms where people came to heal instead of to die. The ward was organized, quiet, the kind of place where vital signs stayed stable and families asked gentle questions about discharge timing. There was no crisis here. There was no drama. There was only the methodical rhythm of wound checks and dressing changes, of stable patients sleeping off anesthesia, of blankets that needed folding and bedpans that needed emptying. Ashford had implemented his isolation strategy with surgical precision. The 2 nurses who'd been friendly to Brooke, Chen and a respiratory therapist named Marcus, were reassigned to opposite shifts. Her access badge was revoked from the ICU wing and the medication dispensary. The charge nurse delivered the news with apologetic eyes that made the humiliation worse, not better. It's hospital policy for nurses under performance review. Brooke nodded once and returned to folding blankets in a unit that felt like exile. The linen closet had a single window that overlooked the emergency bay. She folded sheets in rows, corner to corner, smooth and precise, the way she'd learned to fold uniforms during basic training, and watched the sky through that narrow rectangle of glass. Hours passed. Monitors beeped. Patients woke disoriented and confused. She talked them through the post-op fog in a voice that was patient, steady, invisible. At 11 p.m., the life flight radio crackled through the hospital's internal speaker system, Sacred Heart, Life Flight 1 inbound, ETA for minutes. Multiple trauma, catastrophic IED injuries, VIP patient inbound from Syria. Trauma bay standing by. The emergency wing exploded with activity. Brooke heard it through the walls, the sudden sharp voices, the sound of equipment being wheeled into position, the urgent ballet of people who knew exactly what they were doing. She watched through the recovery unit windows as the helicopter descended, its rotor wash hammering the parking lot like applause. The machine touched down, rotor blades whipping the night air into something visible, something almost solid. When they wheeled the stretcher past her unit toward the trauma bay, she saw the patient's face for exactly 3 seconds. 20 years older. Decorated with scars that told stories she could read like muscle memory. But unmistakable. The eyes were the same. The angle of the jaw was the same. The 8-year-old boy she'd pulled from a collapsed school in Tikrit, pulled from the rubble of a building that had been a school that morning and was dust by afternoon. The boy whose father had pressed his unit patch into her blood-stained hands and said, "Keep him safe." A patch still sewn into the lining of her jacket. A boy who'd grown into a Marine general. She stood holding a folded blanket and watched him disappear through the trauma bay doors. Her hands did not shake. Her breathing did not change. But something ancient and protective woke up inside her chest, something that had been dormant for 3 years, something that had been ordered to sleep and stay asleep and never surface again. The general was here. In this hospital. In Ashford's hospital. And Brooke Sullivan was trapped in post-surgical recovery, behind revoked access badges, under performance review, exactly where Ashford had placed her to ensure she could never interfere with anything that mattered. He had moved her down and locked her out. He had calculated perfectly, systematically, with the precision of a man who'd learned that invisibility could be weaponized. But that wasn't the worst part. The worst part was that somewhere in Trauma Bay 4, a man she'd saved once was fighting to survive, and she couldn't reach him. The post-surgical recovery wing smelled like antiseptic and stale air, the kind of unit where nothing happened, where stable patients went to sleep off anesthesia before discharge. Brooke moved through room 304 with mechanical efficiency, checking the Foley catheter output, verifying the flow rate, documenting vitals on a chart that would never be read urgently. A hernia repair. A knee arthroscopy. Routine cases with routine recoveries, the kind of nursing that required a pulse and a license, not experience, not skill. Not anything resembling the work she'd spent 3 years trying to forget she was capable of. The assignment board in the post-surgical break room read like a punishment manifesto. Room 301, stable post-op, monitoring only. Room 305, routine appendectomy, vitals Q for H. Room 312, elective spinal fusion, pain management protocol. Brooke noticed the pattern immediately because she'd been trained to notice patterns, patterns in enemy movements, patterns in vital signs collapse, patterns in how men decided to use their power. Dr. Ashford had engineered her reassignment with surgical precision. Not a single trauma case. Not a single critical patient. Not a single admission that would require judgment calls or complex decision-making. He was isolating her from the floor's high-acuity cases, ensuring her assignment list remained so deliberately unremarkable that her presence became invisible again, even to herself. Her hands, rough with old scars from field medicine in Tikrit, changed dressings on a woman recovering from routine gallbladder surgery. The patient thanked her, smiled, said she had gentle hands. Brooke didn't tell her that those hands had once sewn a man's femoral artery together in a collapsed school basement using fishing line and a penlight from a rifle scope. Hands weren't supposed to carry histories like that. Hands were supposed to be neutral. Clean. Forgettable. At 1,447 hours, the overhead intercom crackled with the coded announcement that froze the entire floor, Level 1 trauma. ETA for minutes. Multiple gunshot wounds. 3 patients incoming. Brooke's body responded before her mind caught up, respiration shift, pupils dilating, muscle memory calculating tactical assessment and triage criteria. She was moving toward the trauma bay when the charge nurse, Marcus, grabbed her arm. "You're post-surgical." Ashford made it clear, "Stay in your assigned wing." "There's a level 1 coming in," she said, voice level. A statement. Not a question. "Not your level anymore." Marcus's face was apologetic but firm. I know it sucks, but he's already called administration. Your access badge won't even swipe on the trauma floor right now. She stopped walking. Looked at her hands. Looked at the cardiac monitor in room 312 showing a steady, unremarkable rhythm. The woman who'd thanked her for gentle hands was sleeping peacefully, her post-operative pain well managed. Everything here was fine. Everything here was safe. Everything here was a cage constructed from policy and protocol, and Brooke understood with absolute clarity that Ashford was tightening it deliberately. He was neutralizing her by making her irrelevant. She returned to the post-surgical wing and stood at room 307, watching a middle-aged man whose blood pressure was textbook perfect, whose oxygen saturation was unremarkable, whose recovery was proceeding exactly as textbooks predicted. Outside, beyond the walls of the post-surgical wing, level 1 trauma was arriving. Outside, the kind of medicine that required snap decisions and combat experience was unfolding. Outside, she was useless. 20 minutes later, at 1,523 hours, the cardiac monitor in room 309 began alarming. Brooke moved through the door and found an elderly patient post-op from hip replacement, now experiencing atrial fibrillation, her blood pressure dropping in response to the arrhythmia. Standard management. Push 6 mg of adenosine 4. Monitor for conversion. Reassess. The medication worked. The rhythm converted back to sinus. The patient stabilized. Crisis averted. Brooke documented the event, filed the report, moved to the next room. It wasn't that she wasn't busy. It was that nothing she did here mattered enough to remember. The announcement came at 1,547 hours, different from the first, major trauma incoming. ETA 3 minutes. IED blast injuries, multiple casualty event from overseas. Brooke's entire body went rigid. IED blast injuries meant hemorrhagic shock, thermal burns, traumatic brain injury, the kind of polytrauma that killed the strongest soldiers and left the survivors permanently altered. IED blast injuries from overseas meant military personnel, which meant trained combat medics arriving with these patients, which meant the trauma team would be collaborating with military protocol instead of civilian protocols. She could see the scene without being there, the trauma bay doors opening, the ventilators already running, the 4 lines already established by the flight medics from the military transport. She was moving toward the trauma bay elevator before her conscious mind had made the decision. The hallway stretched like it had when she was younger, when she still believed distance was something you could measure in meters instead of in the weight of decisions. She reached the swipe lock for the trauma wing. Pulled her badge from her pocket. Pressed it against the electronic reader. The reader beeped red. Access denied. The hospital intercom system announced arrivals the way hospitals did, clinical and spare, Trauma Bay 1. Trauma Bay 2. Incoming life flight. Stand by for briefing. Brooke stood frozen at the locked door, badge hanging from her neck, watching through the reinforced glass as the trauma bays activated like a choreographed sequence, nurses positioning equipment, respiratory therapy setting up advanced airways, surgeons scrubbing in at the sinks. The life flight helicopter had landed on the roof. The stretchers were coming down. She could hear them now, the sound of organized urgency, the rhythm of a trauma response that didn't need her. The trauma bay doors burst open, and the first patient came through on a stretcher, his uniform covered in the dust of a Syrian IED, his face obscured by the oxygen mask and the 4 lines and the cervical spine collar. The second stretcher followed, then the third. And in the chaos of introduction and assessment, in the moment when the trauma team was shouting vitals and medications and orders, Brooke saw the face of the first patient clearly as they moved him into Trauma Bay 4. She saw 8-year-old eyes, older now, set in a man's face that carried the weight of decades she hadn't lived through. She saw the boy she'd pulled from a collapsed school in Tikrit, the boy whose father had given her his unit patch, faded olive drab sewn inside her jacket lining at home, kept all these years as a talisman against forgetting that she'd once saved a life that mattered. The boy was a general now, his uniform bearing stars, his body broken by the very conflict that had made her disappear. Through the trauma bay glass, she watched his chest rise and fall with artificial assistance, watched the surgical team move around his body with the efficiency of specialists who knew their jobs. Dr. Morrison, the attending trauma surgeon, was calling out orders, 2 units of O negative, get me a rapid infuser, I need a surgical team in 5 minutes, this is catastrophic hemorrhage, get him to the OR. The general's vitals appeared on the monitor above his stretcher. Blood pressure 68/42 and dropping. Heart rate 142 and climbing. Hemoglobin 6.2. Oxygen saturation 89 on maximum supplementation. We're losing him, one of the nurses called out. Pressure still dropping. Morrison moved closer to the surgical field, his hands working with the steady confidence of someone who'd done this 1,000 times. We've got this. Just get another blood product, we're going to need. The cardiac monitor flatlined. For exactly 3 seconds, there was no alarm. No beeping. Just the flat, accusatory line that meant cardiac arrest. Then the alarm came, harsh and relentless, and Morrison's hands froze above the open surgical field, his face shifting from focused concentration to something approximating panic. Come on, he whispered. Come on, come on. Another surgeon, older, moved to the table. I'm calling massive transfusion protocol. We need at least. No. Morrison's voice was rough. I've got this. Give me 2 units of ONEG, fresh frozen plasma, stat. The blood products arrived. The 4 technician ran them through the rapid infuser, the bags compressing automatically to deliver blood faster than normal gravity-fed lines. But Brooke, watching from behind the locked glass door, could see the problem Morrison couldn't see from his angle. The surgical field was too saturated with blood, the hemorrhage was from the retroperitoneal space, somewhere Morrison's current approach couldn't address. The pericardium was compressed, the heart was being suffocated by fluid accumulation, and Morrison was treating the wrong problem. She'd seen this presentation before. In the collapsed school basement in Tikrit, she'd seen a 9-year-old girl with identical vital signs, identical presentation, identical prognosis. That girl had died because no one understood that the bleeding wasn't external, the bleeding was inside the sac around the heart, and the only solution was emergency decompression, thoracotomy, hands directly on the heart. Brooke moved toward the trauma bay entrance. Her badge was still around her neck. She could walk in. She could stop what she was watching. Nurse Sullivan. Dr. Ashford's voice came from behind her, calm as a threat whispered in a parking lot. His hand appeared on her shoulder, pressing down with enough weight to communicate the message without words. You don't work this unit anymore. Your assignment is post-surgical recovery. If you walk through that door, I will have security escort you out of the building. Completely. And I'll ensure every reference you'll ever need is burned. She turned to face him. Looked at his eyes. Calculated the exact damage this man had already done and would continue to do if she moved. He had made 3 calls to board members, she understood. He had alliance with hospital administration, insurance oversight, regulatory bodies that could dismantle her life with signatures. He had already moved her from her position through policy, had already isolated her from critical cases, had already established himself as the authority she was challenging. His phone was in his hand. His finger was already on the screen, ready to dial. His face was calm as a man holding a knife just out of sight. Blood pressure's gone, someone called from inside the trauma bay. No pulse. Do we have a pulse check? Morrison's hands moved faster now, his voice sharpening with the particular desperation of a surgeon watching his patient die on his table. Come on, come on. Let me get my hands directly on this heart, I need to. Epinephrine's in, the nurse called. 1 milligram 4. Pushing now. The monitor remained flatlined. The tone of the alarm didn't change. The general's heart, the boy she'd saved in Tikrit, the man who'd carried her sacrifice across 20 years and 3 continents, was in cardiac arrest, and Brooke Sullivan was standing behind a locked door watching it happen. She took one measured breath. Calculated the cost of every choice that was about to become irreversible. And Dr. Ashford, watching her with the confidence of a man who'd just placed her in checkmate, smiled because he believed he'd finally found her weakness, the one thing that would force her to comply, the one patient she wouldn't walk away from. He had no idea what he was about to unleash. The attending physician stood frozen, hands limp at his sides, eyes locked on the general's monitor as the flat line stretched across the screen like a condemning sentence. The trauma bay fell silent except for the ventilator's mechanical wheeze and the steady pulse of the code blue alarm that nobody was answering. Brooke stood on the other side of the glass partition, post-surgical recovery ward, watching through the reinforced window as the cardiac arrest unfolded. She wasn't cleared for trauma. She wasn't cleared for this. Ashford's reassignment had locked her out of every critical unit, every emergency, every moment where her hands might remember what they'd been trained to do. The general lay on the table with his chest torn open to the ribs, shrapnel wounds packed with gauze, both legs bandaged from IED blast trauma. His pupils were blown, his skin the color of old paper. The attending kept looking at the clock instead of his patient, the universal gesture of surrender in medicine, timing the moment he could call it. Brooke's hand moved before her mind caught up. She didn't hesitate. She didn't calculate risk or consequences or what her termination papers would say. Muscle memory took over. The kind that lives in your hands after 200 battlefield surgeries in a combat hospital tent where the closest thing to anesthesia was morphine and the only certainty was blood on your gloves. She pushed through the trauma bay doors, and nobody stopped her because in that moment of chaos, in that flat second between life and death, everyone's attention was somewhere else. The surgical tray sat within arm's reach. A scalpel gleamed under the overhead lights. She grabbed it with her right hand, the hand that had sutured a Marine's femoral artery while incoming rounds hammered the tent's corrugated walls, the hand that had tied off a bleeding brachial artery with her teeth and her fingers because that was all she had. The scalpel's edge was sharp enough to whisper through skin. She didn't announce herself. Didn't explain. The attending physician stepped back automatically, reading her posture like a book written in surgical precision and authority. She positioned her left hand below the general's left nipple, felt the intercostal space between the fourth and fifth ribs, and made the incision with one swift motion. The scalpel parted skin and muscle tissue with the sound of a knife through silk. Blood welled up. She set the scalpel down and used her fingers now, blunt dissection through the fascia, through the pleural space, pericardial sac releasing under pressure with a hiss of air that meant decompression, meant the pressure that had been crushing his heart was finally gone. Her fingers found his heart. Cold. Motionless. A fist-sized muscle that had pumped through 8 years of that child's life in Tikrit, through his military academy, through 3 combat tours, and now lay inert against her palm like something that had forgotten how to live. She began direct cardiac massage. Compression. Release. Compression. Release. The rhythm older than medicine, older than hospitals, the physical conversation between a hand that refuses to accept death and a heart that hasn't been given permission to quit. 20 compressions. 30. Her other hand worked simultaneously, fingers searching the pericardial sac for bleeding she could control, for a surgical solution to a problem that had just hours ago been an IED in Syria turning a Humvee into shrapnel and fire. The monitor beeped once. Twice. 3 times. The rhythm climbed, 72 beats per minute, sinus rhythm, the sound of electrical redemption. The general's pupils constricted. Blood oxygen saturation began climbing. The attending physician stood frozen, watching a miracle happen in the clinical language of numbers and waveforms and the kind of impossible recovery that didn't fit inside his textbooks. Dr. Ashford appeared in the trauma bay doorway. He didn't move. Didn't intervene. Just watched with eyes that calculated faster than any computer, already drafting the report, already composing the narrative that would justify every call he'd make in the next hour. His face was still, but his jaw worked slightly, the physical manifestation of a mind already 3 moves ahead, already planning the institutional retaliation that would make this moment of heroism become the final nail in a career's coffin. Brooke's hands kept moving. The general's chest rose and fell under the ventilator's rhythm now, stabilized, alive, the electrical signature of survival writing itself across the monitor in green. She stepped back. Her scrubs were soaked with blood. Her hands trembled slightly, not from fear, but from the residual adrenaline of holding death back with bare fingers and the raw knowledge of what she'd just done to her reconstructed life. Within 40 minutes, a nurse found her stripping off the blood-stained scrubs in the break room. By the time she finished, security was waiting with HR papers in hand. The summons came as a phone call, administration, now. The hospital attorney sat behind polished mahogany with 2 witnesses present, the machinery of institutional protection already engaged. Ashford stood beside the desk, perfectly composed, that calculating expression now sharpened into something harder. His voice when he spoke carried the weight of someone who'd already made his calls, already activated his leverage, already turned the hospital's legal structure into a weapon. Miss Sullivan, he began, and the use of her last name without her title was itself an accusation, a demotion, a statement that she was something less than she'd been an hour ago. You performed a surgical procedure without authorization, beyond the scope of your nursing license, in direct violation of your restricted status placement. I saved his life, Brooke said. Her voice stayed level. Steady. The tremor was entirely gone, replaced by the kind of calm that comes from having already survived far worse than this. He was in cardiac arrest. The attending was unable to intervene. Exactly, Ashford said, and his smile was the smile of someone watching their strategy succeed. Your absence from the trauma bay was not incidental. It was your status. He would have been transferred. A cardiac surgical team from Memorial would have been called. You made a choice to exceed your authorization, and now we have a liability nightmare. He turned to the attorney. Show her the termination papers. The attorney slid them across the desk. They were already drafted. Already signed by someone with authority. The discharge summary was already written, employment terminated effective immediately due to violation of restricted scope of practice, unauthorized surgical intervention, gross insubordination. The word swam on the page. Brooke read her career's obituary and felt nothing, or rather, felt everything compressed into the space behind her sternum where 8 years of invisible survival had taught her that some things were always going to cost you. Security will escort you from the building, Ashford continued, his voice taking on that false sympathy tone that was somehow more cruel than direct anger. You saved his life, Ms. Sullivan. But you ended your career. Some rules exist for reasons. He delivered it like a benediction from someone who'd never bent a rule in his life, who'd never watched a patient die because protocol mattered more than instinct, who'd never understood the difference between a nurse and a warrior. Brooke signed the papers with steady hands. Her signature was still the same signature she'd given to the Army 19 years ago. She turned in her badge, the badge that said Brooke Sullivan, RN, and nothing else, no indication that the hands turning it over had held together things people thought were permanently broken. Security, 2 men in grey uniforms who looked uncomfortable, escorted her down the corridor past nursing stations where people who'd worked beside her for 3 years suddenly couldn't make eye contact. The elevator ride down felt like descending into a different geography entirely. The hospital laundry room was in the basement of Sacred Heart, past the mechanical equipment and water heater, a space that hummed with the sound of industrial washers and dryers working through the endless cycle of contaminated linens becoming clean again. Brooke had brought her scrubs down herself, not waiting for the courier system. She stood in the room alone as evening became night, folding scrubs one after another, and each fold was a memory. The navy blue scrub she'd worn the day she'd first gotten the assignment, the day they'd told her to become invisible, to bury the major and live as just a nurse, just someone pushing a cart. The blood-stained pair she'd worn in Tikrit, scrubbed clean now but still carrying the ghost of that blood in the fibers. The set she'd worn the day the general had arrived, the moment of recognition that had shattered everything. She folded the last pair and set them on the clean linen shelf at 11:47 at night, and that's when the sound arrived. Rotor blades. Low and heavy, the distinctive thump-thump-thump of a military helicopter cutting through the Houston night air, impossible to ignore, the sound of something massive descending toward the hospital's landing zone. The building's windows vibrated. The fluorescent lights overhead flickered once, then steadied. The sound grew louder, closer, the kind of noise that made your nervous system recognize this was no civilian aircraft, no standard medical transport. This was military. This was authority arriving unannounced. Brooke's hand stilled on the folded scrub she was holding. She walked to the small ground-level window and looked up at the sky where a marine transport helicopter was descending through the night with its spotlight illuminating the landing zone like a stage being prepared for something final and irreversible. The rotor wash hit the laundry room windows like a physical force, rattling the panes until Brooke thought the glass would fracture. She didn't look up from the scrub folded across her hands. She'd counted the folds exactly 147 times. The sound of boots on concrete outside. Doors slamming. Voices shouting orders with the clipped precision of active duty personnel. The building shuddered again as the helicopter descended through the night, and Brooke finally moved to the window, pressing her palm against the glass that was still vibrating from the rotor pressure. A marine transport helicopter sat in the ER landing zone, its spotlight carving the darkness like a blade. Security detail emerged first, 2 officers with the bearing of men trained to move through hostile territory. Then a colonel in dress blue stepped out, his jaw set tight as concrete, his eyes already scanning the building as though searching for coordinates on a map. He knew exactly where he was going. He knew exactly who he was looking for. The laundry room door opened without a knock. The colonel's voice cut through the mechanical wheeze of the industrial dryers like a blade through silk. "Major Sullivan. Where is he?" Every muscle in Brooke's body went motionless. Not from fear. From recognition. From the understanding that 20 years of shadows had just ended. She set down the scrub she was folding with the same precision she'd used performing that field thoracotomy 5 hours earlier. Steady hands. Measured breathing. She turned to face the colonel, and something in her posture shifted. The woman who folded hospital linens for minimum wage became something else entirely, someone whose spine had been forged in a place called Tikrit where 9-year-old boys were pulled from rubble and handed to their fathers. "ICU," she said. "3rd floor. Northwest corner." The colonel's eyes moved across her face like he was reading a classified document. He nodded once, sharp and final. "You stay here. Secure the area." He was already moving back toward the door when the monitors above ICU activated through the hospital intercom system, broadcasting vital signs that were now climbing steadily. BP stabilizing. O2 saturation rising. Sinus rhythm holding firm. The elevator doors opened somewhere above them. The general's voice, rough, barely conscious, but edged with a certainty that cut through the morphine and the trauma and the catastrophic injuries that should have killed him, reached down through the building's communication system like a hand gripping the throat of reality. "Major Brooke Sullivan," he said into whatever device the nurses had held to his mouth. "Medal of Honor recipient." The colonel's expression didn't change, but his jaw tightened by a micron, the kind of tell that only people trained in interrogation would catch. He turned back to Brooke, and his hand produced a file folder that looked like it had been sealed in federal custody for 20 years. "He wanted you to have this. Before the rest." She took it. The weight of it should have been impossible for something made of paper, but it was dense with the accumulated gravity of 2 decades of classified service, of a military record that had been officially burned while she was officially living as nobody. Her name appeared on the first page in Arial font, followed by dates and units and operations that had been erased from every public record. The door burst open again, and a SEAL team leader entered in tactical gear, his face scarred on the left side in a pattern Brooke recognized. She'd been standing beside him when the IED detonated in Sanjin Valley, Helmand Province, and her hands had kept him alive until the Black Hawk arrived. His name was Mercer. He'd been her spotter for 73 combat operations. Mercer's eyes locked on hers, and something like grief washed across his expression. Recognition of a ghost who'd been alive all along. "Navy Cross," he said quietly, as though each word cost him something. "Silver Star. Purple Heart. Purple Heart again." And then, he paused, and his voice dropped to something that sounded like prayer. "Medal of Honor. Presidential Citation. 20-year service record with 847 confirmed lives saved in theater, and another 4,847 saved in civilian trauma medicine. You never once took leave. You never once transferred out. You just kept showing up. The colonel produced handcuffs. Not for Brooke. His voice rose loud enough to carry through the hospital's corridors. We need to secure the medication storage. Dr. Marcus Ashford is under federal investigation. 2 FBI agents who'd been waiting in the hallway moved past them like predators that had finally located their prey. Ashford was standing in the medication dispensary. Brooke could see him through the observation window, his face already the color of old parchment. He'd known. Somewhere in that calculating mind of his, he'd known this was coming. But knowing and experiencing were different things. The senior agent, a woman with eyes like a steel door, held out her badge. We have evidence you attempted to access and forge military personnel records to discredit a federal witness. You contacted a records clerk at Bupers using falsified credentials 3 days ago. That's identity theft. Obstruction of justice. Interference with a federal investigation. Ashford's mouth opened and closed like a fish thrown onto dry dock. No words came. The agents moved past him into the storage room, emerging minutes later with archival boxes filled with the paper trail of his incompetence, the sloppy amateur hour mistakes of a man who'd believed himself too important to be caught. The hospital administrator appeared in the hallway, his earlier confidence evaporated like water on a hot skillet. Dr. Ashford is suspended effective immediately pending investigation. His voice was thin, practiced in the cadence of someone reading from a prepared statement because the alternative was admitting he'd allowed this man to poison the institution. The charge nurse, the one who'd delivered Brooke's humiliation 2 weeks earlier at Ashford's direction, who'd announced the demotion in front of 6 arriving nurses while Ashford watched with the satisfaction of a man whose strategy was proceeding perfectly, stood in the hallway with tears streaming down her face. Her name was Patterson, and she'd worked at Sacred Heart for 11 years. I'm so sorry. I didn't know. He told us you were dangerous. He said you were unstable. I should have known. Her hands were shaking. Chen, who'd watched Brooke's steady composure through every humiliation without saying a word, moved past Patterson and took Brooke's hand, gripping it like a lifeline. The senior FBI agent produced handcuffs. Dr. Marcus Ashford, you're under arrest for drug diversion, falsifying medical records, witness intimidation, and attempted forgery of federal personnel records. The steel of the cuffs caught the fluorescent light as they clicked shut around his wrists, and the sound was clean. Final. Like a door closing on a chapter that had haunted Sacred Heart for longer than anyone had realized. Ashford's eyes found Brooke across the hallway. For a moment, just a fractional second, his composure cracked. You're nobody, he said, and his voice was the sound of a man watching everything he'd built collapse into ash. A night shift nurse. This is a mistake. The general's voice came again, this time from the monitor visible in the ICU alcove down the hall. His chest was bandaged from the thoracotomy, the incision Brooke had made with her own hands, the surgeon's work she performed knowing exactly what it would cost her. The monitors showed his vitals climbing into stable ranges. BP 118/72. O2 saturation 94%. Heart rate 88, steady as a metronome. That nobody just saved my life for the second time, doctor, the general said, loud enough for every nurse and orderly on the night shift to hear. And she did it knowing exactly what it would cost her. His eyes moved across the hallway where Mercer stood, where the colonel stood, where Brooke stood with her spine straight and her hand steady. In Tikrit, she was already a legend. But she came back anyway. To be nobody. To protect people like you. As the FBI agents led Ashford toward the emergency bay, past the overhead paging system that had once called her Nurse Nightingale like a weapon, past the trauma bay doors where she performed the most dangerous surgery of her life, past every nurse who'd watched her maintain perfect composure while being systematically destroyed, Brooke realized something had shifted. The invisible woman was invisible no longer. 2 years later, Major Brooke Sullivan stood in the ceremonial hall at Walter Reed Medical Center wearing dress blues, her chest carrying ribbons that had been classified for 2 decades. The Navy Cross hung beside the Silver Star. 3 Purple Hearts arranged in ascending order. The Medal of Honor positioned at center, where everyone could see it. The general, fully recovered and restored to active duty, kept that faded unit patch framed in his office, the one she'd carried since Tikrit, sewn inside her jacket lining, a single thread connecting her past to her present. Beside it was a photograph of the major in those same dress blues, the one who'd saved his life at age 8 and again at age 28. At Sacred Heart Hospital in Houston, Dr. Marcus Ashford worked the night security desk, checking IDs and avoiding eye contact with every nurse who passed through the entrance he once commanded. His medical license was revoked. His criminal conviction was public record. His name appeared nowhere in the hospital's directories, nothing but a cautionary tale whispered in break rooms and staff meetings. When new nurses asked who the man at the security desk used to be, the older one simply pointed to the tribute wall in the main corridor. Brooke's story was featured there in bronze lettering: Major Brooke Sullivan, Medal of Honor, Navy Cross, Silver Star. Combat Medical Service, 847 lives saved in theater. Civilian Trauma Medicine, 4,847 lives saved in secondary service. Exemplary composure under extreme duress. When Nurse Chen passed his desk with a new graduate on orientation, she pointed to the tribute and said, "That's who we aspire to be." Ashford looked down at his logbook and said nothing. He was a security guard now. A man who checked IDs for minimum wage, invisible in the way that Brooke had once been forced to be invisible. The difference was that Brooke's invisibility had been a choice, a sacrifice made with intention. His was a punishment, the natural consequence of a man who'd underestimated the quiet person in the room. The general presented Major Brooke Sullivan with the hospital's highest civilian honor, standing in full dress uniform, his chest carrying his own ribbons and decorations. When photographers asked for a quote, he did something that made every person in the room understand exactly what kind of soldier she was. He knelt before her in full dress uniform, the same way his father had knelt 20 years earlier in Tikrit when she'd handed him his living son. "Some warriors carry rifles," he said to the cameras, to the assembled staff of Walter Reed, to everyone watching. "Others carry stethoscopes. Both require the same courage." Brooke accepted the honor with quiet dignity, one measured breath, her spine straight. The closing shot showed her hands, those steady, capable hands that had held lives together in impossible places, that had folded hospital linens while being systematically humiliated, that had performed emergency thoracotomy under pressure that would have destroyed anyone less forged in battle. No trembling. No hesitation. Just the hands of someone who'd survived the worst and chose to give the rest. Sometimes the bravest warriors carry stethoscopes, not guns. If you've made it this far, you know that quiet strength is the most dangerous kind. Subscribe for more stories about the people nobody sees. Like this video if you've ever been underestimated by someone who had no idea who they were standing next to. And comment, would you have the courage to walk away from everything to save one person? Let me know.